Welcome to this special broadcast on the occasion of World No Tobacco Day. I am your host Kritika Jaiswal, and today we will know from Dr. Rajneesh Kapoor, Vice Chairman, Interventional Cardiology at Medanta Hospital, the dangers of tobacco on heart. Doctor, is it safe to consume tobacco in limited amounts?
See, very clearly, there is no safe dose of smoking. Men who smoke even occasionally have an overall death rate that is 1.6 times higher than the death rate in non smokers. Absolute no.
Is smokeless tobacco also harmful to heart?
Some forms of smokeless tobacco increase your heart rate and blood pressure. Evidence suggests that long term use of smokeless tobacco actually increases your risk dying from heart attack. So there is still an incremental disease going on inside the body even with smokeless tobacco.
Doctor, can passive smoking trigger heart disease?
The passive smoking or the passive smoke exposure is also a risk factor for having a heart attack. There's no doubt about it. Breathing secondhand smoke, or what we call as passive smoking, can cause the cells in your blood that are responsible for clotting, the platelets, to become stickier, making your blood more likely to clot. So it's also leading to an increased clot tendency. This can cause a clot to form that may block an artery and causing a heart attack or a stroke. Secondhand smoke also causes endothelial dysfunction, which makes the arteries unable to dilate. This condition is also associated with many forms of cardiovascular disease. Now, chemicals found in passive smoke also irritate the lining of your arteries, which is endothelium, causing them to swell. So there is inflammation which starts into the lining of the arteries. This inflammation can narrow your arteries, increase your risk of having a chest pain related to heart, which may be in the form of angina or a heart attack. It's also very important from this given data to avoid passive smoking if you have any previous increased vulnerability towards a heart disease or have been diagnosed as a heart disease.
Can tobacco also trigger heart attack at young age?
Smokers are almost twice as likely to have heart attack compared with people who never smoke. So irrespective of age, smoking is leading to increased vulnerability towards heart attacks. No age limit, no gender bias. Smoking is deleterious. Smoking is hazardous for any of the sex and any at all points in the age.
Doctor, what is your message to the society on World No Tobacco Day?
So this is very important. It should be a very emphatic message, and that's what through this platform I like to deliver. Stopping smoking is the single best thing you can do for your heart health. And the good news is that the risk to your heart health decreases significantly soon after you stop. This is not only important for your own health, it's also very, very important for your family's health.